Hi, I'm Dr. Paul Hodgson, and I'm a chiropractor, but we actually specialize in some unique things. Normally when I tell people I'm a chiropractor, they're thinking neck pain, back pain, headaches, migraines, and while traditionally we are very good at those things, we have a lot of training in them, my unique training is actually in pediatrics and childhood ear infections. So why this is such a unique and fun area to work in is that many parents have taken their kids in and their kids have been suffering through ear infection after ear infection after ear infection. A big problem with the diagnosis of ear infection is oftentimes it's done without any sort of culture or any sort of proof. And ear inflammation can look exactly like an ear infection. So a doctor will typically look in the child's ear and he'll see redness and potentially swelling of the ear, of the inner ear, and he will say, that's an infection. Well, it might just be that it's ear inflammation, which looks exactly the same. So what we do as chiropractors is we don't try to make a distinction between the two, but we do try to evaluate the function of that entire area. So that's going to be the bones of the lower skull, the bones of the jaw, the bones of the upper neck. We need to make sure that everything is aligned properly, and we need to also clear the eustachian tubes so that they're able to drain properly. When the eustachian tubes are draining properly, we know that the body's going to be able to deal with almost anything. Standard medical treatment for ear infections is going to include antibiotics. It's going to include a whole host of things to alleviate the symptoms caused by the ear infection themselves. And eventually what the doctor is going to recommend after the child had multiple ear infections is going to be typically tonsil removal, adenoid removal, and tubes inserted into the ears so that the ears can actually drain externally instead of internally. This is not a great recommendation in my mind, and it almost always is unnecessary. We've had some amazing success in our office with kids who are scheduled for surgery, kids who have actually had the surgery and now it's not working it's still not working, the ear infections are still happening. And it has to do with really simple, gentle alignments to the upper neck, to the craniofacial bones, and to allow the eustachian tubes to drain properly and the body to handle the infection themselves. Oftentimes there's a dietary component that we use as well, but that's not necessary in every single case.